applicants for showing up today, and hopefully some of our applicants' guests are here for us to meet you guys as well. We got a lot of great speakers for you today. We got a few deans, some from each campus. We have some outstanding students to share their perspective, what it's like from their particular campus from Kansas City, Columbia, and Springfield. We have a division chair to talk about some of the exciting research that goes on within the school. So with that, I will go ahead and introduce our first speaker, which is Dean Russ Melchert. Dr. Melchert.
Thank you, Steve. Welcome, everybody. We're excited to have you here tonight. I think one thing you should ask yourself right now, two things you should ask yourself right now, is why pharmacy and then why UMKC? So I just want to speak a little bit about both of those things. And when you think about why pharmacy, what great opportunities there are for pharmacy careers. You know, most people maybe, and hopefully some of your family members are here, your loved ones, but even if they're not, they ask you, why pharmacy? Do you want to work in a pharmacy? And you know, certainly a great career opportunity for our graduates are to go into community pharmacy practice. You know, usually about half or more of our graduates go into community pharmacy settings, either for large pharmacy chains, for grocery store chains, for even independent practice. And there are some great opportunities there. And I'd like to highlight one of our alums who's working in independent pharmacies in rural Missouri, who's recently expanded his practice to include a pharmacogenetic service. Can you imagine that? Even in a community setting, we have alumni who are looking at the impact of a person's genome on how they might handle, their body might handle drugs when they take them. And he's making recommendations then to that patient's physicians on the genetic factors and how they may impact that patient's ability to eliminate drugs, for example. So in a community setting is a vibrant practice, and it's exciting. Growing across the nation are opportunities for pharmacists even to do independent prescribing. There's been a well-recognized lack of primary care providers throughout the country, so people don't have access to care. And then a recognized realization that pharmacists are the most accessible healthcare professionals that there are. 90+% of the country lives within 5 miles of a pharmacy. So in many states across the country, they've expanded the scope of practice, including Missouri, expanded the scope of practice for pharmacists to include independent prescribing. Today in Idaho, for example, as a pharmacist, you can prescribe almost any drug that there is independently of a prescriber, and you are a prescriber. So everything short of controlled dangerous substances, and even those you can prescribe with a collaborative practice agreement with a physician or other prescriber. So it's exciting times in community pharmacy, but there are so many other career opportunities that most people don't know about. Let me tell you about one of our alums that we just saw on the national news, on ABC National News. And she, Dr. Janelle Sabo, is a graduate of our program, and as a Pharm.D. went to work for Eli Lilly. With Eli Lilly, she got into research and development, new drug development. At one point, she was heading up the Pacific Rim, Asia, and Tokyo and all their clinical trials of Eli Lilly's new drugs, but most recently featured on ABC News nationwide for her work in leading up their efforts in developing new treatments for COVID-19. And in fact, she's running clinical trials for new monoclonal antibodies to help patients that suffer from severe COVID-19 respiratory distress. Our grad, Janelle Sabo, right there on the national news, leading the fight against COVID-19. So we're so proud of her. That's a career option you might choose. Other career options include, of course, the military. Several of our graduates every year go to work for the Air Force or for the Army or for the Navy, and there are exciting career options there. Or for the Public Health Service, where pharmacists go throughout the country working for the Indian Health Service on various reservations throughout the nation, helping Native Americans with their care. And it is a very vibrant and very progressive practice in those settings as well. And then some of our graduates go on to work for regulatory agencies like the FDA that you've heard so much about in looking at approval of drugs and new drugs. Some go to work for boards of pharmacy, and others go to work for even agencies with the Department of Justice, such as the DEA and the FBI. So I even had last year a call from the Federal Aviation Administration looking to hire pharmacists. And you may think, airplanes, pharmacists, what does that have to do? Well, even aviation needs to be advised on drugs, and who better to do that but Pharm.Ds and graduate from our program. So there's a million reasons why to go into pharmacy, and maybe I didn't need to convince you of that. But there are also a lot of reasons why you should choose UMKC for your Pharm.D degree. It does matter where you get your Pharm.D degree. And if you go in the US News and World Report rankings, you would see that UMKC ranks in the top 31 of all pharmacy programs nationwide. We're very proud of that ranking. We have a very good reputation nationwide. Our graduates, as I said, go into great positions and are well recognized. So that's one reason. But you also want to make sure that the academic performance that we have here is here to assist you. We have a student success program that makes sure that each student has the care they need and the assistance they need to be successful, and it's worked quite well. On average, about 94% of our students will graduate on time. Graduating on time is important. That means lower debt load if you have to take student loans. That means a quicker path to your career. And then you have to take the board exams. And on average, 92% of our graduates will pass the exam. Over the past 5 years, 92% are passing the board exams on their first attempt, 97% passing the board exams within 6 months of graduating. And then further, what if you're interested in postgraduate career opportunities? Well, we have a lot of opportunities there. Some of our graduates go into residency training. So they go, for example, if they want to work in a specialized setting, some of our grads, for example, go on to work in emergency departments or rounding with physician teams in cardiology or cancer treatment. So they might want to do a residency to specialize in those areas. There's a nationwide process where you apply for residency match. And this year we set a new record for UMKC. We matched 83% of our students that were graduating that were going to the residency matched with their first choice at prestigious places all across the nation, such as the Mayo Clinic, Johns Hopkins, Duke, and then prestigious places here in our local area, at all of our hospitals at Truman Medical Center, and our hospitals in Springfield and St. Louis and Cox Health and Mercy Health. Getting those residency positions is key. So there's a lot of great reasons to come to UMKC, and I'll just give you one more. If ESPN would track pharmacy programs and put us on the ticker tape of who's number 1 in the country, guess who's number 1 in the country? UMKC. Our student pharmacists, the Academy Student Pharmacists, part of the American Pharmacists Association, competes every year with all the other chapters, over 134 different chapters in the country, to see who could be the best at providing patient care services such as diabetes screening, immunization, women's health, bone mineral density, blood lipid screenings, and all of these things they do each year, and it's competitive, and they have to report. It's not a popularity contest. It's how many patients were served, what activities did our students have in the community. And this past year, our students were number 1 in the country, but they were also number 1 in the country in 2012, and top 4, top 7, top 4, top 4, top 7, number 1 in the country 3 times. And where else can you go and get that kind of recognition? That's how our students get the great jobs. That's how our program is so well recognized. And it's all due to a great faculty and staff that care for each and every one of you. Obviously, I'm very excited about UMKC and our pharmacy program. I'm excited you joined us tonight. I could talk forever, but Steve McDonald is telling me I got to cut it short. We got time for other speakers, so we'll stay on the line for questions that you might have. But thank you for joining us, and thank you for listening.
Yeah, that's great. Dr. Steve Stoner, would you like to take the floor?
Sure. I don't know that I can follow that up and do it justice, but thanks, Dean Melchert. And welcome, everybody. Thanks for joining us tonight. There's just 2 things I'm going to touch base on. I am the Associate Dean for Student Affairs, and so focus on student outcomes, student organizations, networking. I'm also doing COVID monitoring right now for our program. So really anything that involves students, there's the potential that I have the opportunity to work with you and work with different student groups. So I've been with UMKC for quite a while. I've been here since 1996, practiced in psychiatry for many years, and then served as a department chair, and then recently just became the Associate Dean for Student Affairs. So really committed to our program, have seen all of the successes that Dean Melchert was alluding to. And one area that we're really proud of is our advising and our student success. And so one thing that I would just want you guys to all understand as you come into our program is that you will be assigned a professional development advisor, or PDA. And that advisor will be at the campus where you're located. So if you're in Columbia, you would have a Columbia faculty advisor, same in Springfield, same in Kansas City. And so there's the opportunity to build personal relationships with our faculty. And how that translates is, if you have academic struggles, that's somebody to talk to set up a plan to help get you through the tough times, but also networking. And as we get to know you over your 4 years in our program, we have a lot of contacts within the profession of pharmacy. And as we get to know you and interact with you, we can put you in touch with the people that are out there hiring and making a difference. And so we really truly value the ability to get to know you and to build those relationships. And that occurs through our advising program that we have. Now, in addition to that, we have ACPE accreditation standards that really require us to do assessment monitoring. And we've termed that student success. And so my predecessor, Dr. Trish Markin, helped to build a student success program that I'm proud to say we're continuing. And really what this allows us to do is that with each set of examinations for students that maybe aren't scoring where they want to be scoring, my office will get notified, and then we'll start a process to get in touch with the student and also include the faculty advisor. So there will be another touch point or a point of contact. And we don't want anybody to fall through the cracks. The curriculum is not easy. It's a professional school. You wouldn't want it to be easy. But we have a support system in place that once you're a part of our program, we want you to stay a part of our program. And we have a vested interest in you and seeing you be successful because you're going to be our alums. And so we want a happy set of alumni out there. And I think it's a great experience. I think it's a great program. Like I said, I've been here, haven't wanted to leave. The UMKC has become my home. And so just I really get excited talking about it. And so we're gonna do things to set up you for success and maintain those contacts. And I think if you're looking at schools and really want to get a sense of what maybe sets UMKC apart from others, I do think the personal relationships that we're able to build between the students and the sense of community and networking that occurs in Columbia, in Springfield, in Kansas City, and then collectively as a whole. I think that we do that. That's something we do really well. And I'm very proud of that. And I'm also very proud of how we give back to our communities in Springfield, Columbia, and Kansas City, but also the state of Missouri. And really giving back and serving those in our community and really focusing also on underserved populations. That's something, again, that we're very well known for. So anyway, advising, assessment monitoring, student success, those are all the things in my wheelhouse. So look forward to talking to you guys tomorrow morning for those of you that are interviewing tomorrow. And thanks for joining us tonight, and we'll stick around for questions in a little bit.
Great. Well, next up, we have the president of the Student Council for the UMKC School of Pharmacy, Emily Montgomery. Would you like to take the mic?
Yeah, hi guys, my name's Emily Montgomery. I am a third-year student here in Kansas City. I actually graduated from Mizzou in 2018 with a chemistry degree, so I think I see some familiar faces on this Zoom too that I might know. And I chose to come to Kansas City as kind of following my sister. She lived here, so that's why I ended up in Kansas City. But this school has done great things for me. I love being a part of it. APHA, ASP, as Dean Melcher mentioned earlier, the patient care events we do, I've been able to go in the public and do blood glucose screenings, blood pressure monitoring, and just really talk to patients more, which you don't think would ever make you nervous, or I didn't, at least, because I talk all the time. And I was like, oh, okay, I need to work on that a little bit. So just that real world experience really helps. And you always have a pharmacist there with you, so you're never like on your own. There's always somebody to talk to. And even in Kansas City, I work at a hospital up here, and all my coworkers either go to school at, the students, at least the interns, go to school at KU or UMKC. So even the work relationships you can get really help you with school. And UMKC has really set us up for that. They let us know when places are hiring around here, so we can get jobs. And then the student orgs are just amazing. I could keep going on, but I'll let Kyle talk too. He's on my team as well.
Hi guys, my name's Kyle. I'm actually a fourth year student at UMKC, so I will be graduating soon. In December, I'll actually be sending my applications for residency programs. So I am from a small town, Orick, Missouri. I did my undergraduate at UMKC. I did the accelerated program, so I did the prereqs and then jumped right into it. So let's see. Oh yeah. So when it's like learning at UMKC, so you have satellite campuses. So if you're at Kansas City campus, you usually have teachers in the classroom, but you will experience teachers from other campuses. And it's really not any different. I don't think I got any different experience than being remote. It was still very interactive. And when you see those professors in person, when they come to Kansas City, they're surprisingly look different up close. And when you're at But I've actually gotten to know a lot of people from the distance campuses through the organizations I've been involved in, which has been really cool. So the organizations that I'm involved in Pharmacy Student Council. So I work with Emily. I represent the school financially at the main UMKC campus with funding for organizations. I'm in PLS, which is a leadership society. They have lots of organizations that give you really great opportunities. You can write essays and get those published. You can learn about new areas of pharmacy. So there's an organization for psychiatric pharmacists. There's an organization for oncology now. That's brand new. There's also some fraternities. There's 2 of them. And those are a great way to make friends. We have a volleyball tournament every year, which is like the best thing in the world. It's so much fun. And then the big organization is American Pharmacists Association. With that organization, you get lots of patient care experience. I've gotten to go teach kids healthy lifestyles. So I went to elementary school and did that, go to events, do blood pressure screenings, check blood sugars for diabetes. It's a really great way to interact with the community and get that patient care experience, which is very beneficial, especially when you start rotations. So far, my rotations that I've done, I've been at St. Luke's. I did an advanced community, which I did a lot of education on prescriptions. I did a PICU rotation, so I was at the ICU at Children's Mercy. And then I'm currently on my administration rotation. That's another area of pharmacy you don't really think about, is an admin. You can go to specialized residency programs and get an MBA, and then you can go directly into administration and manage other pharmacists. It's a totally different world, but definitely another career option as well if you're, into that stuff. I'm not really sure how I'm doing on time. My really only advice is that I would build relationships. This campus is great with the classmates. Everybody was super friendly. I know people that were above me that just graduated, and I know people that are below me as well. Being involved is really important, but I think the relationships are probably my favorite part of being at UMKC and making all the friends and being a part of the organizations. It really has made my experience really great. And that's all I have. I'll turn it over to Dr. Gubbins.
Okay, thank you, Kyle and Emily. I'm Paul Gubbins. I'm the Associate Dean here in Springfield at our MSU campus. It's a collaborative program with Missouri State University. And some of our speakers have already touched on this, but students who have been in your shoes, who've chosen UMKC, have really enjoyed their decision. Our student satisfaction surveys show that overwhelmingly students look back when they graduate and they've enjoyed the experiences that they've had at UMKC and on all three of our campuses. And that's because, as many of our speakers have already said, the students really make our program. From our championship student organization, ASP, that Dean Melchert discussed, to our business plan team, which is relatively new, that's had top 10 finishes for the last 5 years, and actually all 5 years where they actively competed. And this year we have a quarterfinalist group for a clinical pharmacy challenge, which is like a quiz bowl, if you will. So our students are known nationally for their efforts, and they perform on a national stage at a high level. But each site also offers its own unique experience. For example, Kansas City, if you want a large group learning setting, access to research labs in a big, vibrant city with a championship football team and soccer team and great museums and a rebuilding baseball team, then Kansas City is the place to go. Columbia, which was the original satellite, and Dr. SOMMI will give you a little bit more update on Columbia. It offers small group learning in a vibrant major academic health science center in a rural environment with a campus life that has the SEC vibe to it, with football on Saturdays and large general studies type of campus. Springfield, where I'm at, is the newest site. It's been around for 5 years. You can also enjoy small group learning in one learning space. We're in one building on one floor. We're centered in a moderately large, third largest city in Missouri community that's in a medically underserved area. And that really gives us a lot of opportunities to serve the community. As Dr. Stoner said, a lot of our students serve the community. We have a lot of very large health systems, private, that we interface with as well. And we're also known for our tiny table tennis, which has been put on ice for the COVID year, but hopefully we'll get back to that next year, where we have a tournament every March. There's a lot of exciting opportunities to serve the community here in Springfield. We have a partnership with a local nonprofit that looks at drug diversion and opioid use, and also drug education in an underserved area. And our students have earned a prestigious competitive interdisciplinary scholars programs known as the Ambrose Scholar Program, which is a public health scholar program. It's interdisciplinary. And we've had students that get that honor 5 years running now. And then several of our students have also been recognized by the U.S. Public Health Service nationally for their efforts in public health. And there's only 70 schools in the country that get that honor. And in the last 3 years, our students have come from Springfield, and 2 of them have even finished in the top 10. So I think one thing that you can be proud of in selecting UMKC is that we will, through our student success and our desire to see you succeed, we will give you every opportunity to do great work and move the needle as you start your career. So I'm going to hand it over to one of our students down here in Springfield who can talk to you about what it's like to be a student at Springfield, Kevin Hauk.
Thanks, Dr. Gubbins. I'm Kevin Hauk. I'm a P3 here in Springfield. I'm originally from Bentonville, Arkansas. Graduated from the University of Arkansas in Fayetteville way back in 2005 with a degree in psychology. So I definitely took the roundabout way to get here to UMKC, but I'm super glad that I did. So if you're a non-traditional student as well, you'll be welcome, and you'll be right at home, and you'll be glad you came here. I found out about Springfield probably just through a Google search way back in the day. Was tired of working with what I had been doing and needed to change a career, and here we are. And I'm really glad I made that choice. Being a satellite campus here in Springfield, well, we're just the best campus. I think that's objectively true, and just from the facilities and have the close-knit nature, everything that we have there is great. The way that the classes are set up, most of the classes, especially in your first couple of years, will be coming from Kansas City or Columbia. You'll have a few people in Springfield, but the way that the classes are set up, the technology they have there really is still engaging, and you can really feel like you're in the classroom and you can really get something out of it. One thing I like the most is the size of the class. So we only have about 30 or so students per class in Springfield, and the 29 other kids in our class are some of the closest friends that I've made in the last, I don't know how many years. Just being stuck through it all together and going through it, and we have a lot of study space there, so we really get a chance to get to know each other. And like I said, they're just a bunch of great people. I'm really glad to have met them. Same with the professors. There's not a professor there that I don't know by name, that doesn't know me by name. And even some of the professors outside of our campus as well, they have a chance to really get to interact with them. But the group that we have there on campus can't be beat. There are a ton of organization opportunities, even though we're a satellite campus. I'm in practically all of them. I'm in APHA and SCCP and SSHP and CAPSI and ROCI and PLS. So you have every bit as many opportunities to get some organizational leadership or just to network as much as you would at any other campus. I think my favorite subject that I've had so far is MedChem, the first year class. And it's a little bit different than the other ones. And some of the professors are characters, I'd say, but it was a fun class. It's a little bit different, and coming from maybe not the most traditional pharmacy background, it was nice to get in that way. Let's see. We also have opportunity in Springfield when we do our interprofessional educations to have events with the PA students and nursing students at MSU and Missouri State. So a couple times a year we've met up with those PA students and have had a chance to kind of see a different perspective on healthcare. We did a poverty simulator with them one time. That was pretty cool. You'll do that your second year, and it's a good time. What I remember from my admission interview, I did mine in Kansas City. I didn't do mine here in Springfield, but it was just how open everybody was and how readily accepting all the staff and even the other people interviewing. The interview itself was not that bad. We ended up talking about comic books more than anything. But if you just be yourself and go out there, if you've made it this far, then you're on the right track already. So I would just say that you guys have made if you're looking at UMKC, then you've already made a good choice. And if you end up at Springfield, then you'll make a better choice. With that, I'll hand it over to Dr. SOMMI in Columbia.
So, I got to follow that up with, and if you go to the Columbia campus, you've made an even better choice. You know that, Kevin, right? So I always like to start out with MIZ. Got to unmute for this one.
ZOU. ZOU.
Okay. It's not as good as it is live. We got to get Stoner to do it, though. He's got.
You'll notice a Nebraska poster over my shoulder.
But he does have Garrett. He's got some reasons to root for Mizzou now. That's where he's spending a lot of money over there these days.
I am paying 2 tuitions over there right now.
I am Roger SOMMI. I am the Associate Dean for the University of Missouri Columbia campus. I've been at UMKC for 37 years. I spent most of my years in Kansas City. I'm actually joining you from Overland Park, Kansas right now, where my house is. But my goal is to teach you a little bit about the MU campus. And so we're you know, Dr. Gubbins gave you a nice outline of the 3 different campuses. You know, the big difference is we're on a big SEC campus with 31,000 students. Football team, they say, is a football team. We'll see. We got a new coach, so we'll see how that works. We got a basketball team, women's and men's basketball team. So if you like the sports part of it, we got lots of sports. Although the MSU Bears are pretty good too. The Roos, not so much. But hey, we got to root for them anyway, right? So, you know, in terms of opportunities, there's lots of opportunities. Our students are very engaged. They take leadership positions within the organizations. We have had the Vice Chancellor's Student Award come from the MU campus several times. I mean, I've only been there 7 years, and for 3 of those years, we've had one of those awards. We do a lot of interprofessional education with the School of Nursing and the School of Medicine. It's a really important relationship for us. There's a competition that comes out of that called the Clarion competition. And so one student from the MU campus gets to go to this competition with other students. And we've always placed in the top 2 or 3 groups nationally. They go to Minneapolis to compete against other interprofessional groups. We're a little bit more spread out because it's a bigger campus. We're in 2 different buildings. The faculty are in one building, and the classrooms are in another building. But there's a lot of interaction between the students and the faculty. I think there's a lot of great things that happen there with that. As Dr. Gubbins pointed out, you know, in a small classroom, you have that more sense of a community. What I find is, you know, students are taking care of each other. They do that in Kansas City, but with, you know, 30 students or so, it is just a little bit different feel. In terms of academic performance, our students perform really well. I mean, I was looking at the end result, right? 83% residency match is what Dr. Melchert said. I mean, that's just amazing. I mentioned that to the director of pharmacy this week in my meeting with him, and he's like, he almost dropped his teeth. You know, he couldn't believe that we placed it that high and that there were that many students going into residencies out of our program. And I hear over and over and over again, you know, oh, you know, I'm doing my APPE and I'm here with students from fill in whatever university, and I'm running circles around them. They don't know this, they don't know that, they don't know how to do this, and so that's always you know, redeeming to hear that as a faculty member. Some other things that we got going that are a little bit different. So we on campus is our academic medical center, right? So the hospital, the cancer center, the nuclear reactor for radiopharmaceuticals, the vet school, all of those things sit right on campus. So it's really easy access to all of that. So I could go on and on and on, but I'm gonna turn it over to Kaylee Nichols, who, and I know there's a lot of you that were either in my 1100 class or my 7100 class, or are currently in my 1100 class over the years. And Kaylee was also one of those, what, 3 years ago or so, right?
Yep, I think I took that my freshman year at Mizzou.
All
Okay,
right.
so
You got it.
hi everyone, my name is Kaylee Nichols. I am a P3 student on the Columbia campus, and I'm just going to talk a little bit about why I think Columbia is the best campus. So I'm from a small town outside of Springfield, Illinois, and chose to go to Mizzou for my undergrad. And then I actually found out as I was a senior in high school that Mizzou also had a satellite program for UMKC School of Pharmacy. So I made the decision pretty early that I thought I wanted to stay in Columbia, and I the whole time I've been very, very glad that I did. So one thing that people kind of get a little nervous about going to a satellite campus is that classrooms is going to be a lot different, that the teachers aren't there right in front of you, but like you get used to it the second day of class, and then I've never had it be a problem at all. The professors are all amazing with getting back to you right away. You have microphones in class that you can ask them questions on the spot. And we've kind of talked about it a little bit, but having the smaller class size, we only have 30 students per class, is really nice. I know everyone in my class. I have a really good study group. We'll study with about 6 of us, which is super nice. And then also being so close with all the faculty on Columbia has been really helpful, knowing all of them, and they help us get connections around the community. And we also, with the large Mizzou med school and nursing programs, we're able to work with those people, and it's really nice to get some interprofessional education through that too. Some other things about being on a smaller campus is it's really easy to get involved. I've held numerous positions throughout school here, so it's very easy. Like, you don't miss out on any of those things. All of the organizations are at every single campus. So I've definitely felt like I've got to be involved in all of those. And I think that's about all I have, but I'll stick around for questions after. And I will turn it over to Dr. Wyckoff.
Well, thank you. I appreciate that. And I think one thing that I'll just say, my name is Jerry Wyckoff. I'm the chair of the Division of Pharmacology and Pharmaceutical Sciences, long name Basic Sciences Division. And I'm the director of research and graduate studies. And so I'm here to talk to you a little bit about the research that we do. So one thing I want to say and make sure you hear is that coming to UMKC will expose you to a wide variety of primary work being done, developing new drugs. Those will be the drugs that are going to make a difference in patients in the next 10 to 20 years. So it's a good reason to come here is that we have a lot of faculty working on that aspect of pharmaceutical sciences. An example would be somebody like Dr. Simon Friedman, who's looking at light-activated depots so that you can take insulin, hook it to a molecule, implant it, and then have the insulin basically be controlled just by a light and another device. That's a game-changing technology that's being worked on right at UMKC. We have Dr. Kun Cheng, who's working on new delivery systems for different types of cancers. These are molecules which would allow a drug to get right where they're supposed to go to kill cancer, as opposed to making sure that it's supposed to going everywhere and causing all the sorts of problems, the side effects, the adverse drug events that happen when you don't have these drug targeting systems. We have somebody like Dr. Bill Gutile, who's working on the next generation of antimicrobials. A key problem that we face is antimicrobial resistance, and we have faculty working on that. And you might wonder, well, why is that important to me? And the answer is because if you want to work with the FDA, with a pharmaceutical company, you want to be able to work with faculty who are going to be able to expose you to that kind of research, that level or caliber of research. A new faculty member we've just brought in recently is Dr. Emma Meyer. She's working to try to make drugs not for humans, but for animals, for companion animals, for farm animals. Taking drugs that are used in humans, redosing them so that they can be used in our furry friends, right? And that's a pretty cool industry to get into, because one of the things you start to realize is there just aren't that many veterinary pharmacologists in the country. And we have one of them right here at UMKC who's doing research work and is just over the moon to be here and wants to work with all of you coming in with the research projects that she has. And if that's not your cup of tea, if working with that sort of thing isn't what you were interested in, we have other types of research going on here as well. Something like 80% of the outcome of a patient medical encounter isn't just about the drugs or the doctor or whatever, but it has to do with the setting, the environment that that patient's coming from, what their life was like before they come into your world, and what it's like when they leave it, those social determinants of health. And we have somebody like Dr. Sarah Prinovich who's working diligently on those sorts of factors. We have people working in rural healthcare, trying to enhance rural healthcare. Dr. Cochran's working on that. Dr. Mark Patterson's working on transitions of care. What happens when patients move from, say, a nursing home to a hospital setting, back to a nursing home, and then maybe back to somebody else's house where they're being cared for by family. Those sorts of transitions can really mess up patient care. How do you fix that? How do you streamline it? So we have faculty actively working on all of these issues. The other aspect of something that I deal with are our graduate students. Now, you're all wanting to come here and get a Pharm.D, and that's awesome. We also have about 40 students getting PhDs. And the cool thing about that is that you interact with those folks as your GTAs. And if you do what's called directed individual studies in some of our labs, you'll work with them as peers in the lab, learning from them. And they're a vital part of what we do. They love working with students because you bring a different perspective to them. What I see is an environment here where, regardless of what your interests are, the kinds of interactions you can have with researchers will help power your careers on the way out, regardless of where your careers take you. And some of those characters who teach MedChem, yeah, those are my faculty, right? And part of the reason why they're characters is because they really are excited about teaching this stuff to all of you. And sometimes, you know, they'll go on for a bit and you'll be like, what are they saying? The great part is that if you go and interact with them, they'll tell you in explicit detail about why they're interested in about it. And the great part about that is the excitement for the research shines through in what they're doing. So I really hope you all come here. I hope that we get to interact. I hope that you consider doing some research with us. And I think, honestly, you can't go wrong for a campus. But I have been on the KC campus for about 18 years. So I will say go Roos, right? And we do have some great teams. And when women's basketball kicks back off, all of you should go and come to the Pouch of Ouch and watch a great team play some great basketball. Thank you.
All right. So thank you, everybody. That was really great stuff. I even learned some stuff today, which is pretty good because I've been here for a little while myself. So what questions do we have for our guest speakers? And we'll work on that right now. And then after that, we'll work on some interview questions as well.
One question I had was, how does like the student organizations, how do those interactions work across the satellite campuses? Are they separate organizations at separate campuses, or are they all like interlinked?
Kaylee, do you want to answer that? I know you are a liaison for the student council.
Yeah, definitely. So most of the organizations are all like one chapter. So like APHA, for example, is the largest pharmacy organization. So we're all one chapter, all under the same thing. But then we also we branch out between campuses. So there's a campus president at Columbia, at Springfield, at Kansas City. So we're all working together and we collaborate. Like I'm the women's health chair this year, so I work with the other campus women's health chairs as well to brainstorm. But then I'm specifically in charge of Columbia's women's health campaign and run all the events here. So it kind of works both ways, that we're all together and then we do our own thing at our own campuses as well.
Awesome, thank you.
I know somebody mentioned the 2 fraternities earlier, and those are actually co-ed fraternities. So lots of people join those. So what other questions does everybody have?
I have a quick question. Regarding cost and scholarship opportunities, do you mind explaining any of that?
Sure. Yeah, I think we have Shelly Janez on the line. I think she was going to handle some of those questions.
Hi, welcome everybody. Thanks for being here this evening. For scholarship programs, we do have special scholarship programs. The School of Pharmacy actually at UMKC has one of the largest, if not the largest, pharmacy foundation of programming. So we have quite a few donors that are alumni from the school and or donors that are different constituents that we've had really great relationships with. And on our website, we've got a number of scholarships for students once they enter the program. We just actually awarded close to think it was over $1 million of scholarships to students, and just sent out letters to students for, we have an Achievers of Excellence celebration each fall. And during the fall semester, this fall, we're doing it, it's not a live ceremony like we have had in the past, since we're doing the pandemic, but we are still having a ceremony and then doing a live Zoom with the students and the donors afterwards. So there's an opportunity for students to apply. There's one actual application that all pharmacy students apply to. We send out an email to students in the spring, actually, and then P1 students through P4 students can apply. And what the scholarship committee does is they then look through, some of our scholarships are very specific, and they might be, you have to be from a certain region of Missouri, or you might have to have had, community pharmacy experience. It depends on what the donors have put down for the scholarships. And then others are wide open and say students with financial needs. So then that covers a wide breadth of students, certainly, in the program. But we also have a couple that when students that apply or they enter, we have a program for students who are out of state, and there's a Dean's Non-Resident Award. So any U.S. citizen or permanent resident, they're eligible for the Dean's Non-Resident if they're out of state. We also have a Dean's Scholar Award that students can apply for. And these are specific for first-year students. A number of the pharmacy scholarships are actually specific to just first-year students. We also, for students who are maybe at MU, or UMKC or another system school, if they had a curator scholarship while they were at MU or a system school, we honor that curator's award for the first year of the Pharm.D program. So they can carry it over regardless of whether they were at UMKC or not. So, and the School of Pharmacy picks that award up. Bright Flight is the same thing. Sometimes we'll have students that were awarded, if they're from Missouri and had a Bright Flight, then that will still cover when they're in the School of Pharmacy as well. So we have quite a few awards, and then students apply for federal financial aid. Students can come in as an undergrad if they come in without a degree, or they come in at the professional level. So the levels of aid are a little bit different. And I know we sent out a financial aid sheet that explained that a little bit, but many times we might have students, if they came in without a graduate degree, if they don't have a baccalaureate degree, then we have a loan program that's specific just for pharmacy students called the Hargrave Loan. And we're able to help that gap need for students if they apply for the Hargrave Loan. So that's helped a large number of our students as well. So, and it's low interest, it's subsidized, and students don't have to pay that one back for several months until after they graduate from the program. So it's a very good loan to have. So I hope that answers a little bit of your question.
All right, maybe one more question for one of our guest speakers. All right, well, I will let the guest speakers go, and then I will hang on for a little while if anybody would like to talk about the interview. So thank you, everybody, for coming.
Thanks.
So if you would like to talk about either if you're interviewing today or October 9th, or maybe you plan to interview, later on, I'm happy to help you out.
Thanks for coming, folks.
Thanks. Good luck.
See you all tomorrow. Bye. Good luck.
Thanks. Good night. Good luck.
All right. Well, do you guys have any questions about the interview coming up? You all feel pretty good?
I have a question, but not specifically about the interview.
Sure.
So as far as the classes right now, because I know with pharmacy, we have labs and stuff. How is it different with the COVID now? Because I know right now with my classes, we're just taking like virtual labs, like it's all online. And I don't really appreciate that much. Like I want to be able to like do the experiment myself. So as far as like pharmacy classes, how are you guys going about that?
Well, I don't know if Dr. Stoner's still on, but I will let Shelley address that because she does the room scheduling for all 3 campuses, and God bless her.
It's really fun. It's gotten to be a good juggle of fun, particularly this year. It was very different. So for some of our lab sessions, so Some of our courses are discussion group labs. So certainly they're not like wet labs like you have in organic chemistry and general chemistry and some of those classes. So we do have a course called aseptic technique. And that one you have to come to campus for aseptic technique checkout. So there's a lecture that's with that, and they talk about aseptic techniques and the technology and all of that, those pieces with that. But there is a time that students have to come and they have to practice the aseptic technique. They have to be under the hood. And certainly that's not a lab that you come once a week to do. Same with our compounding lab. We have a compounding lab in both aseptic technique and compounding, and we do those. We have lab spaces in Springfield, Columbia, and in Kansas City. So students then do, for compounding, you have to be there to compound, but you're in full PPE, certainly. So if you're in aseptic, it has to be sterile. Same with compounding. And for those labs, you're actually in a gown, you have a, hat on your head, and you have, a mask on and goggles on. You're certainly all covered up. You're, some of those things that you'll get when you're in school. You have to have goggles, you have to have a lab coat, all of those good things. But those are the main two that you have to be on campus for. There is an immunizations class that it's taught actually online for this semester, but then, or it was in the spring, it moved to online. But then at the end of the semester, students had to do checkout, because to do your immunizations, you have to be in person so the faculty member can see that you're doing it. We want you to be able to do an immunization correctly and to be certified to do that. And what they ended up doing in the spring with that is, because everybody got called off campus and they couldn't come back for immunizations and aseptic, because aseptic was in the spring, we then modified, and all of the students got an incomplete in the spring. And then when we came back in the fall, everybody was scheduled individually, one at a time, and those course coordinators and the faculty then met with the students and watched them so that they could pass the class. So they all ended up, getting credit or letter grades for the class so that they can continue on. So we just really had to adapt with it. Compounding is going on right now. So I know Dr. McQueen has students coming in for compounding. There's a lecture of that, and then they do have to be in class for the lab. But those are really the main courses that it's more of a kind of a hands-on lab that you have to be at. We do have discussion groups and lectures, and we're trying really to do hybrid. Like this year, our first year students, we wanted them to be socialized, honestly, because you don't know each other. And so we put all of the first year classes were in person, except for the law class, which we did that one online. But then if there's any issues right now, students, if they have an accommodation, they can't be here because of health or an accommodation, we've set it up that they could be online. Students do have to be in person for tests, but they don't have to be in class, and our faculty have been very flexible with that.
All right, that was pretty much what I was looking for. Thank you so much.
You're welcome.
I will say, when we're not in COVID phase, we don't have anything online. We love being in person with everybody. The teachers really want to be in a classroom with you. So even though it's distance learning, you're always in a classroom. I will also say I only get my flu shots from pharmacy students. I did it once with somebody outside of there. They were a little rough on me, but pharmacy students are getting graded. They're gentle and pleasant. So anyway, Daphne,
they know we're in control of their diplomas, and they're like, oh gosh, here comes student affairs. We better be really, really on top of our game here for it. So.
Are you guys seeing any difference in grades from like COVID learning versus regular learning?
Not really. I mean, actually for this in the spring, what happened is many universities and campuses went to credit, no credit, and we'll accept that for prerequisite classes, but our faculty, it was very important to them in a professional program, particularly once students graduate from our program, you're dealing with life and death situations and people's lives, and we did not change the grading basis for our students. So they had to, if a class was letter graded, it was kept as letter graded. and everyone passed. And certainly there had to be accommodations for that. Our faculty had to turn it around within 3 days, that they went from, you know, in the classroom to online. Now our faculty were able to do that really quickly because we do already a satellite with the Springfield and the Columbia campus, and or they'll come in from us, because sometimes faculty will be teaching from Springfield and then it will be transmitted to Kansas City and vice versa from Columbia. So they were already adept at that and were able to, you know, take the classes by the reins and get them taught. So everyone passed in the spring. We didn't, you know, again, I think we had students that it was very difficult for our students because they, like Steve said, were normally in person, and being away from everybody, that was hard on our students. And two, a lot of our students, their classmates are everything to them because they studied together and they help each other out. And so, you know, certainly now they do it over the wire, but most of our P1 students are in class, and then P2 and P3 are kind of a hybrid right now. And like Dr. Stoner said, who's doing the student success, I think our really tough class for the P1s is biochemistry. Certainly biochemistry and physiology are tough ones for students to transition into, but we have top-notch faculty who teach in those classes, and they really know what to look for and help students out. So
now, you'll find in pharmacy school, if you try to miss a class, you're going to get 6 texts from your classmates wondering where you're at.
I have a quick question.
Yeah.
If a student's already taken like biochemistry, do we have to retake it again?
It kind of depends. So if you have biochemistry 1 and 2 since fall of 2016 that we've approved for that, then you can transfer that course or those courses into the program. You would not have to take the 4-hour pharmacy biochemistry class in the first semester, which meets Monday, Tuesday, Wednesday, and Thursday at 8 a.m. So people are never sorry when they come in with biochemistry. If you have a 1-semester biochemistry, we can look at the syllabus, and Iowa State University offers biochemistry 2 online over the summer. At least they always have in the past. I can't ever promise they'll keep doing it, but they have for the past few years. And we can see if the 2 syllabuses will match up enough to cover enough for our pharmacy biochemistry. So feel free to send me any biochemistry syllabus that you want us to look at, and we'll have our people take a look at it. Good question. That's the only course that will transfer into the Pharm.D program. The other thing that you will do once you're in the Pharm.D program is take elective credit hours that you get to pick what you want to take. And those cannot transfer into the program. So those will have to be, you have to have the pharmacy mindset when you take those. And if you would like to do the MBA, if you come in with a degree, you can actually jump right into the Pharm.D/MBA program from all 3 sites. If you don't have a degree, you can do the MBA program starting your 3rd year, P3 year, I believe. And all of your MBA classes can count towards pharmacy electives, and some of your pharmacy classes will count towards your MBA classes. So it's a pretty slick system we have set up. Say we have a couple more.
Yeah, just one more question. Are there any questions in mind that maybe we should go over before the interview, like maybe top questions or things maybe we should keep in mind before attending our interview?
Well, I know the faculty really want to know why you want to do pharmacy. So come prepared to explain exactly why you want to do pharmacy and why you're passionate about it. That's the big thing that comes to mind.
I would encourage you to read through your application. So definitely go back through, because many of you submitted your application several months ago. Read what your personal statement, what you wrote in your personal statement, or any special circumstances, or many of you submitted a COVID statement. So reread that, and then also definitely look at any kind of gaps in your application. So if you had a semester where it was pretty tough, be able to explain that, because the faculty member who you will be interviewing with, they have your full application, and those are the things that they're going to be looking for, or students that might have had withdrawals. So certainly be able to explain any kind of gaps that you've had. But definitely, your experiences in pharmacy will be important, or if you haven't been, we don't require that students have worked in a pharmacy setting at all. But if you haven't, if you've researched pharmacy, and again, just like Steve said, why pharmacy? And certainly we want everybody to be able to help people, but it will need to go, further than that and be able to explain, what your interest is. And even particularly if you've compared it with other professions that you have been looking at as well, that's always a good, your stories are very important.
And if you took any prereqs for a grade of passing or credit, that's all fine. The faculty might still ask you how it was going and what you think of it. So just keep that in mind. And if you have a lower PCAT score than you would like, they may ask you about that. So, if you're not a great standardized test taker, let them know. If you were sick, let them know. And just kind of explain, you can turn a lot of negatives into positives. Something bad might have happened, but you've learned from it and you moved on, and it's made you a better person. One faculty member told me one time he liked seeing a D on a transcript because it shows that you've been through adversity and you've come above it and you've done better since then. But I'm not sure everybody feels that way, and we don't want too many Ds, otherwise you wouldn't be here. But so yeah, maybe one more question for us.
I have a question. At this point, is it possible for us to get an idea of the class load and the scheduling for outlooks like having family members that are still going to want to work while I'm doing the program? Or if I want to continue to do work during the program, is that even feasible? If you could answer that, that'd be awesome.
We do have students at work, pretty much, I'm going to say 98% of them work, 97%, it's very high. Many of them, they have to, if a student's been working 40, 30 hours a week while they were an undergrad, or maybe they're done with their classes, that's actually where that's going to have to be tempered. I mean, students cannot work that many hours and do well in the pharmacy program. So, because they're also within the pharmacy program, you've got your academic courses that you have to complete, but you also have co-curricular requirements, and those co-curricular requirements will require students to be out in the community as well and partake in some of the leadership opportunities that we have. And that's actually helps them with networking as well as some of the hands-on things that they'll be doing when they're in their pharmacy practice rotation. So that's it's very driven that way. But pretty much the majority of our students are working part-time as a pharmacy intern. You have to have a pharmacy intern license after you enter the program. But many students were already working as a tech before they got here. But usually, and when you look at the total credit hours each semester, so certainly if you came in the first year and you don't have to do biochemistry, then you might have a little bit more time on your hands, because biochemistry and physiology certainly take up a lot of time. The second year of our program, the P2 students, it's really, really full, because they're taking pharmacology, they're taking pharmacotherapy, they're taking pharmaceutics, so it's pretty heavy. The amount of credit hours they're taking are pretty heavy. So whenever students have been asked that question, they basically come in and tell us that what worked for them maybe when they were an undergrad, they really had to change it up once they came into the Pharm.D program. And just, if you're a really, really great organizer, that will be imperative once you come here. So, and then certainly being able to tell your family members, I have to study, and being able to say no sometimes more often once you're in the professional program. So, but those are big ones. But our students have been able to work, but they might, certainly if you were working a lot of hours before you entered, then coming down to, some semesters to 10 hours per week, or some semesters you can work more than that. And again, it really depends on what you've got going on at home. Some of our students we have one student in Springfield, and I don't remember, Steve, I think he's got 5 children. 5 children. I'm like, oh, how do you do that? But anyway, he's been able to manage to do it. And if you have a good support system, that will be critical.
Yeah, there's definitely students with families in the pharmacy program. And yeah, one guy in Springfield, he is a year older than I am, and I'm not all that young, and he's got a family and he's doing just fine. you did see our 3 P3s and a P4, and they were all smiling and having a good time. And I think that's what happens through pharmacy school. It's tough, but usually they get through it with a smile on their face. So I want to thank everybody for being here tonight. We went through an hour. It went by fast. It's pitch black here in Columbia, and I can see Shelly's losing her light finally.
Oh, I decided to come outside because it was so nice, and I'm like, oh gosh, yeah, I am losing my light. So thank you, everybody. We really appreciate your time.
All right, see you guys.
Thank you.
Bye.
Thank you.
Thank you.
Thank you guys.